Welcome to the practice of Dr. David Green. This presentation explains laser tattoo removal. Laser remains the state-of-the-art method to remove tattoos. At the conclusion of this presentation, all of your questions will be answered and you will be provided with an estimate of the number of treatments and the cost for each treatment that will be required to remove your tattoo. A tattoo represents ink or pigment that has been inserted into the skin. Lasers provide the most effective method of tattoo removal. They have been safely used for greater than 20 years. All medical lasers are quite specific in their tasks. That is, hair removal lasers are only effective for removing hair. Vascular lasers are only effective for removing red capillaries and birthmarks. And tattoo removal lasers are only effective for removing ink and pigment in the skin. Furthermore, tattoo removal lasers are color specific. For example, if a tattoo consists of black, green, and red inks, 3 different lasers must be used. One laser for the black ink, one laser for the green ink, and another laser for the red ink. Tattoo removal lasers produce visible light. This is because tattoo inks and pigments can only absorb visible light. Tattoo removal lasers are safe specifically because they produce visible light. Unlike UV, X-ray, or high-energy radiation, there is no risk of long-term damage associated with visible light. Lasers produce short pulses of high-energy light that pass through the skin until absorbed by a specific color. The laser energy causes the tattoo pigment to fragment into small particles that are then more easily removed by the body. Without anesthesia, laser tattoo removal is uncomfortable. Therefore, we always anesthetize the skin so that the treatment will be painless. The skin is numbed with lidocaine, the same numbing medication that a dentist would use. Because this is local anesthesia, you may return to work or all usual activities immediately after treatment. Multiple treatments are usually required to remove a tattoo. The number of treatments depends upon many factors which include the ink colors present, the skin color at the site of the tattoo, and the quantity of ink in the skin. Other factors may play a role including the depth of the ink, the age of the tattoo, and the location of the tattoo. We will review each of these factors. The most important determinant of the number of treatments that will be required is the ink color or colors that are present. Black ink is always the easiest to remove. Red and yellow require a greater number of treatments, and green and blue are the most difficult to remove. This is demonstrated in the following examples. In this example, there is a multicolored tattoo on the left arm. The photo on the left is the appearance of the tattoo before treatment. After just one treatment, shown in the middle photo, the black ink appears lighter. The photo on the right was taken after the 4th treatment. Most of the black ink is gone, but the other colors will require additional treatments. In this example, there is a multicolored tattoo on the distal leg. The photo on the left is the appearance of the tattoo before treatment. After just one treatment, shown in the middle photo, the black ink appears lighter. The photo on the right was taken after the 2nd treatment. Most of the black ink is gone, but the other colors have not faded as much and will require additional treatments as the next slide demonstrates. This slide shows the continued progress of treatment. The photo on the left is again the appearance of the tattoo before treatment. The middle photo was taken after the 4th treatment. All of the black ink is gone and the red and green inks are lighter. However, they will require more treatments. The photo on the right was taken after the 10th treatment. Although the green ink is much lighter, additional treatments are required. Here's another example showing the rates of progress for removal of different ink colors. In this multicolored tattoo on the upper right back, the photo on the left is the appearance before treatment. After just one treatment, shown in the middle photo, the black ink appears lighter. The photo on the right was taken after the 2nd treatment. Most of the black ink is gone, but the other colors will require additional treatments. The other most important determinant of the number of treatments that will be required is the skin color overlying the tattoo. A tattoo on light skin, as shown in the photo on the left, will be easier to remove than a tattoo on darker skin, as shown on the right. This is because melanin in the epidermis always attempts to prevent the transmission of visible light into the skin. This applies to tan skin as well. If you have a tan, treatment should be postponed until your tan has faded. Another factor that determines the ease of tattoo removal is the quantity of ink present. A tattoo that is faint, as shown on the left, is more easily removed compared to one that is dark, consisting of denser ink, as shown on the right. Tattoos that are elevated above the skin have a substantial quantity of ink and require a greater number of treatments. There are other factors that affect the number of treatments, including the location of the tattoo and the depth of the ink. On thin skin such as the inner forearm, as shown on the left, the ink is usually quite superficial and easier to remove compared to thicker skin such as the distal leg, as shown on the right, where the ink is deeper. The age of the tattoo may also affect the number of treatments. In some older tattoos, ink may have migrated deeper in the skin. Treatments are scheduled at intervals of 6 to 8 weeks. Scarring can be observed after treatment. However, if any scarring develops, it usually appears as a change in texture similar to stretch marks. Less likely, scarring can be raised. If any such scarring develops, it can usually be treated so that it flattens. Often we recommend that a silicone bandage be worn after treatment to prevent any such changes in texture. After treatment, the skin should be washed at least once a day with soap and water. Immediately after washing, Vaseline or petroleum jelly should be applied and then covered with a Band-Aid or Saran wrap for larger tattoos to prevent the Vaseline from rubbing on and staining clothing, bedding, upholstered furniture, or anything else which your skin may contact. Vaseline prevents scabs and promotes healing. This skincare regimen should be continued for 3 weeks. After your treatment, our medical technicians will show you how to bandage your tattoo. After treatment, there are no limitations. You may resume all normal activities, including strenuous activities and water sports. Now let's look at some examples that demonstrate the progression of tattoo removal. In this series of photos, progressive lightening is seen in this multicolored tattoo. It required 10 treatments to remove all of the ink. You will notice in the photo on the right that the freckles came off as well. In this sequence of photos, it required 5 treatments to remove the tattoo. Fewer treatments than in the previous example because this tattoo consisted of only black ink. These photos demonstrate the removal of this tattoo in just 2 treatments. Although this tattoo covers a large area, the ink was not dark or dense and her skin was relatively light complected. Large tattoos do not require more treatments than small tattoos. They just take more time for each session. This tattoo required 8 treatments to remove most of the black ink. The tattoo had been present for 40 years at the time the treatment was initiated. As the tattoo ages, the ink tends to migrate somewhat deeper and wider than where it was originally placed. That is the reason that older tattoos do not have the sharp appearance that they had when they were newly placed. This black tattoo on the mid-chest required just 3 treatments. In this example, although most of the black ink was removed in just 3 treatments, a total of 7 treatments were required to remove the red ink as well. You will notice in the after photo on the right that the final skin pigment was mottled and slightly irregular. This person was somewhat dark complected, and it is not uncommon for there to remain some irregularity in skin color. However, this is usually mild and not conspicuous. This is another example of some irregularity in skin color after treatment, as shown in the photo on the right in this somewhat dark complected person. Here is a photo taken after a series of 5 treatments. Can you identify the treated site? On the left is the tattoo before any treatment. On the right is the tattoo after 5 treatments. Although there is some green and yellow remaining, it is not conspicuous. No further treatments were recommended. It could have required 5 or 10 additional treatments just to remove the remaining green and yellow ink. This tattoo was treated 22 times to achieve the result as shown on the right. The large number of treatments reflected both the density of black ink present as well as the colors that were incorporated in this tattoo. Prior to treatment, the black portions of the tattoo were elevated due to the quantity of ink present. In addition, the colors present were quite resistant to treatment and were slow to respond. Although this woman's skin was light in color, you will notice that the treated skin remains lighter than the surrounding untreated skin. This tattoo required 10 treatments to remove the pastel colors including green, red, and pink in this light complected woman. As alluded to earlier, her freckles came off along with her tattoo. Tattoos can be removed in those with dark complexions, but more treatments will be required and there is a greater chance of irregular pigmentation and possibly scarring. If the skin is too dark, treatment will not be successful. This homemade tattoo on the forehead required just 3 treatments for substantial lightness. This homemade tattoo on the neck was removed relatively easily. After 3 treatments, most of the ink was gone, although there was some irregularity in skin color. Again, this example demonstrates the relative ease in which a black tattoo is removed on light skin. This is another example of a black tattoo in a light-complected man that was easily removed with no remnant or trace of ink, no scarring, and no alteration in color. This concludes this presentation. Now your tattoo will be examined. All of your questions will be answered and an estimate provided for the removal of your tattoo.